QST is useful for evaluating the magnitude of sensory changes as well as to detect and quantify sensory gain or loss. However, by focusing exclusively only on numbers, QST ignores important aspects that can be communicated only through qualitative information. Adding a qualitative component to the QST procedure will add valuable information which could contribute to the detection of sensory abnormalities. Accordingly, our primary objective was to classify qualitative field notes of sensory abnormalities collected during a previous QST study. Qualitative field notes were collected among 48 patients with chronic neuropathic pain treated with spinal cord stimulation during an independent multi-center QST study. 9 QST parameters were evaluated following a standardized QST protocol. After each trial for each modality during the normal waiting time of the QST procedure, participants were encouraged to report any sensory abnormalities they could identify. An inductive approach was followed to infer a general classification based on our qualitative field notes. After identifying emerging patterns, a classification and a coding frame were developed. A total of 630 field notes of qualitative sensory abnormalities were collected. Each field note has been assigned to 3 categories of QST modality: noxious stimulus, innocuous stimulus, and all type of QST modality. Then, according to the experience of the participant, the collected field notes were classified into 2 groups: altered sensory intensity and altered sensory perception. In the first group, altered sensory intensity were divided in the following subgroups: analgesia, hypoalgesia, hypoesthesia, and anesthesia. Sensory gains were classified in the following subgroups: hyperalgesia, hyperesthesia, and allodynia. In the second group, altered sensory perception were classified in the following subgroups: paresthesia and dysesthesia. In conclusion, our findings have highlighted the value of qualitative sensory evaluation during the normal idle times of the QST procedure and could represent an important milestone in the development of a mixed method protocol in phenotyping research. Please read our article to learn more about the qualitative method and the coding book proposed by our team to collect and classify qualitative signs of sensory abnormalities during QST.